Hey there, Dr. James Fedich here, Village Family Clinic. Talk to you about spinal decompression today. So I tell you a little bit about this cool technology here. See our cool motorized spinal decompression tables over here. So we're one of the few offices in the area that do the advanced spinal decompression, and what it does and what it works for. I'm going to tell you a little bit about it. So these are the bones of vertebrae in your spine. Discs are spacers that go in between the bones of vertebrae. And the discs are made out of like a jelly donut. So I tell patients to think about like a Dunkin' Donuts jelly donut. It's got fibers all holding it together and the jelly inside. So these discs naturally move. There are shock absorbers. And they also space the vertebrae apart so there's room in there for these nerves in between there. Now, what happens as we get older, there's a couple things that can happen to these. As we get older, no matter how healthy you are, these vertebrae get a little closer and closer together. That's why you notice your parents or grandparents start getting a little shorter as we get older. So each one of those discs are just getting a little more compressed and dried out as we age. And the reason that these discs do that is the only part of the human body with no nerve flow and no blood supply. So if a disc gets injured, blood doesn't go there. Like if you cut your skin, it'll bleed. There's no natural blood flow to those discs, so it's not able to heal on its own. There's also no nerves there, so you won't feel this happening. So over 20, 30, 40 years, that's getting compressed in there. You may be unaware of it. The only way discs get rehydrated or heal is by movement. So we're normally moving, bouncing up and down, moving throughout the day. Fluids come in and out of the disc, allowing them to heal up. But if those discs are injured or there's an issue in there, they're not able to move properly. The fluid can't come back in here and they'll just continue to deteriorate. They can also bulge or herniate, and that's bulge is when some of the jellies push to the side of that donut and pushing on the nerve. And a herniation is where some of that jelly actually comes out of that donut and can push, rub, or irritate those nerves. So these are bad problems. There's not a lot of things you can do for them. A needle injection goes in there and numbs it temporarily, or we're talking major spinal surgery. But most advanced non-surgical treatment you can do is non-surgical spinal decompression. These tables have been FDA approved for over 20 years. We've been doing it for 15 here at the clinic. And what these tables do is they're able to gently traction or open up that vertebrae, allowing that disc to get sucked in a little bit and opening up the space for that nerve in there. They're very sophisticated computers can control these machines. They're able to pull in a specific pattern that doesn't irritate you or hurt the spine. Gently tractions and releases allows that pumping motion to occur and to also open up that space between those vertebrae. It's over 85% successful, very little side effects. It's pain-free. Most people feel good on it. They fall asleep on these tables all the time. It's one of the most advanced non-surgical treatments we can do for lower back or neck pain. Our tables are able to do neck and back. Some can only do one or the other. We have two non-surgical spinal decompression tables. They're able to do neck or back. So really advanced form of therapy. The first couple treatments, we'll start the machine light. And as we go through a treatment protocol, it gets heavier and heavier pull. So it starts out 50, 60 pounds. It goes up from there, depending on your age, size. We set a customized plan for each patient here. But it's really effective treatment to get the pressure off those discs, off the nerves, and uncompress the spine and make sure that we don't shrink as we get older. So if you're interested in non-surgical spinal decompression, give us a call or text 908-813-8200. See if this might be a good treatment for you.